Okay, today we're doing an exam on Mr. Smith. And Mr. Smith, we don't have some equipment here today, so we had his blood pressure taken in the hallway. It is 135/90, and he is a male, and he is 6'1", which is 73 inches, and his weight is 225 pounds. And according to the BMI calculations, he is considered obese. But according to the racial ethnicity issues, I think that it needs to be fixed in the book so that it shows that he's not obese, he's actually just a little bit overweight, maybe 7-8 pounds. Anyway, so we're going to start our exam, and I'm washing my hands, and here comes Mr. Smith now. Hi, Mr. Smith, how are you?
Hey, how you doing, Dr. Peterson?
Pretty good. Good grip.
Thank you.
All right, so you're here today because you had an infection in your lungs, and we gave you some antibiotics, and you're coming back because you're quitting smoking, and you're still kind of coughing. This is what I've been told. Yes. And you're sort of concerned, so you want to do an overall, just quickie exam so you can make sure you're all right.
Yes.
Okay. Well, first thing then, let's just do a couple of things. There's no pain I should worry about?
Nothing.
Okay.
Just the coughing.
Then let me have you go ahead and touch your toes, if you would. And then as you're doing that, I'm looking at your spine and around your lung region just to make sure that nothing is irregular. Go ahead, come on up. Okay, and go back a little bit, as far as you can. Are you all right there?
Good.
Okay, and go into the side, the other way, turning. You're good, huh?
Yep.
Come on over here. And let's have you have a seat right here. Okay. All right. Well, just the first thing I'd like to do is just, let's take your pulse. Okay. We're taking the radial pulse. As I'm doing this, I'm watching him breathing. And I'm counting just 15 seconds. All right. And it turns out that his pulse is about 62 and his breathing is about 20. All right, so first we're going to do cranial nerves, and let me have you smile at me. There you go, clench your teeth together. Open up your mouth really wide. Okay, and stick your tongue out at me. And bring it this way, bring it that way, and then go ah.
Ah.
Very good. We're looking at the uvula, we're looking at cranial nerves 9 and 10, and trying to make sure that everything was okay in there and he doesn't have anything going on in there that's irregular. Okay, and I'm going to actually palpate your face.
Okay.
You okay with that?
Sure.
Okay, I'm tapping on the sinuses just to see if they're full. Those hurt at all?
Not at all.
Okay. And then I'm going to palpate his lymph nodes, his cervical lymph nodes, to see if they're full. And they feel really good. As we're here, we're looking at his thyroid as well. And it's nice and centered. And it's not enlarged, and it's pliable, movable, looks good. You ever have any trouble swallowing?
Not at all.
Okay. All right, so this is an ophthalmoscope, even though it doesn't look like one. So I am looking in your ears, and they look really great. We're pulling the ear back and down, and the tympanic membrane looks nice and clear, and there's no cerumen in there or nothing coming out of the ears. Let me have you lean your head back. And we're looking at the nares, and go ahead and look straight ahead. And there's nothing purulent or nothing coming out of there. He isn't even congested in that area. All right, so I'd also like to have you watch my finger. I'm watching for accommodation. Mr. Smith's eyes should dilate as my finger pulls away. And they are. Excellent. Let's look at the cardinal field of gaze here. We're looking for the cranial nerves. Good. And any trouble with the cranial nerves. And then let's go in. Okay, in. And up. I'm trying to confuse you. Okay, and they're beautiful. No nystagmus or anything like that. So that looks great. Okay, and let me have you lean your head back and chin to your chest and looking straight ahead. Looking over this way, the other way. Okay, and ear to shoulder. And the other side. Any pain going in any direction?
Nope.
Okay. I also want to feel the carotid arteries. And that feels very palpable and regular on both sides. And go ahead and push up against my arms. Okay, good. My hands. Okay. And let's have you put your arms out to the side and resist against my hands. Okay, and down in. Resist. Resist out. Very good. And go like this and resist in. Excellent. Okay, and go ahead and push your legs out and pull against my hands. Good. And push out and pull in. Okay, no strength problems or anything like that. All right, I'm actually looking at his chest right now just to look for any irregularities. You don't have any skin issues that you're concerned about?
Not at all.
Mr. Smith does not have alopecia. He chooses to shave his head because I can see there's a line right here of your hair. So there's no problems with the skin around your head.
Not at all.
Okay. All right, well, I am looking for my stethoscope. And this is a stethoscope. And I'm going to listen to your heart. Okay. So first we're listening. There we go. We're listening for the aortic valve, pulmonic valve. Here we go. Tricuspid and mitral. And they all sound really good. I don't hear anything bizarre. Okay. Let me have you take a big breath in. And I'm just inspecting his lungs from the front, okay? And as I'm looking at his back, I'm also inspecting this area, which I've already done when he touched his toes. And I'm going to first listen. Let me have you take a big breath in and out. And again. Good. 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 And again. I'm listening for any kind of pleuritic sounds, sounds that might sound irregular. You sound very clear. I don't hear any fluid in there or anything like that. Okay, take a big breath in. I'm looking for his ribs to expand as he breathes, and they do, and they expand properly. Okay, let me have you laying on your back, please. Okay, and are you comfortable?
I am.
Okay. All right, first I'm inspecting the whole area, and I already kind of have as he's been sitting there, but I'm also palpating, just gently, the upper left-hand quadrant for pain or abnormalities. Okay, I went right and then lower left, lower right. Now I'm going to actually auscultate. I'm feeling for enlarged spleen, or pancreas, over here on the right for the liver, okay, and lower right, just bowel sounds, and it all sounds normal. All right, so I'm taking his dorsal pedis pulse, feels regular, and pulses of his lower legs feel regular. I'm also checking for a return of blood in the nails, and they look fine. Let me see your fingers here. And I'm squeezing, and blood return looks great, so no oxygen problem there. Okay, let me have you sitting up. Okay, I'm going to do Babinski's reflex test. Just to make sure that Mr. Smith doesn't have any kind of problem with his brain or spinal cord fluid. And actually, you're doing great. So just continue to quit smoking. If you have any problem, give me a call, and I can give you a number that you can call to talk to people about quitting smoking. Okay. Because we don't want you to get lung cancer.
All right.
You take care.
Hey, thank you. All right. Bye.